So today we're going to be looking at a case that happened in 1852, and it was published in 1856 by a doctor called Edward Copeman, who practised in Norwich, and he published a book called Records of Obstetric Practice. Edward Copeman reported interesting cases, and he felt that this was an interesting case because there were some instruments that were needed to help deliver the baby. Copeman reports that he got called after the woman had been in labour for about 36 hours, so that's quite a long time for her labour. And when he got there, the woman had been being looked after by a midwife, and when Copeman arrived, the baby's head was at the top of the pelvis, the cervix was fully dilated and so fully open, but the baby's head wasn't moving down, it wasn't doing the turns that it needed to do to work through the birth canal for it to be born. During the 19th century, there were two different instruments that could be employed by doctors. So the forceps are the instruments that we're very familiar with now, but there was also an instrument called the Vectis, and we've got a Vectis here. The Vectis was developed by the Chamberlain family, who were the same family that developed the forceps, and it looks a little bit like a spoon. The Vectis was particularly good because if a baby's head was in a difficult position, if it was in a malposition, the Vectis could be used to alter that position, and that was exactly what Edward Copeman did. So we think that this baby had been going down and had got stuck sideways, and the reason that it wasn't making those turns that it needed to was because it didn't have its chin properly tucked to its chest. And for most babies, to allow them to navigate through the birth canal, they need their chin tucked to their chest so that there's a smaller diameter coming through the pelvis. In this baby, it sounds as if the baby was looking upright, so it wasn't able to make the turns that it needed to. So Edward Copeman used the Vectis, and he went in over the sides of the baby's face and over the back of the baby's head to move the head into a better position and then allow the head to move down, and he used the Vectis to help to deliver the baby. This story is important because before the instruments were delivered that could help deliver live babies, women had the potential to become very poorly if this happened. So we had consequences for the mother and for the baby. For the mother, if she wasn't delivered, and this baby had been stuck for a long time, she could get an infection, so she could become very poorly, and ultimately she could die. She could have a uterine rupture, so the muscle wouldn't contract particularly well and would end up with a flaw in it that would mean the uterus stopped contracting. And again, that would lead the woman to have an infection and to possibly die. For the baby, if the baby wasn't able to deliver, again, the baby could die. So instruments in childbirth are particularly important because it allows us to facilitate delivery, and it allows us to deliver live babies where before these babies would have died, and possibly the mothers. So that leads us to think about risk in childbirth, because the risk, if we don't have access to support, access to help in the form of instruments, means that women have a possibility that they can die. Although most women will have nice normal labours, for the occasional woman who does have a problem, instruments are essential.